Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we have another great show for you tonight, but before we get into the meat of the show, I'd like to talk about caring and sharing. Remember, care about yourself so that you can share that good knowledge with someone else and they can care about themselves as well. We want to improve health for everybody, and we can do that together. Alrighty. Remember, we're on social media now, so Obey Your Doctor for Facebook, for Twitter, and Instagram. Go check us out. We're doing a lot as far as meal planning. We're doing things about weight loss, about education, about different medical diseases. So go check us out on social media. Alrighty? And ObeyYourDoctor.com. That's our website. And all of our information is there. So go check us out. You'll see it's great. So check out our website and social media. All right? Let's talk segment. Now, I've been doing a segment on weight loss, and I think this is so important because I truly believe that weight loss is the key to longevity and it's the key to health. If we decrease weight, if you just take weight, say, for instance, if you bring your weight down 10%, it decreases hypertension, diabetes, heart disease, colon cancer. So many diseases are improved just by decreasing your weight. So let's talk about this for a second. What we need to talk about is that weight gain, there's no secret to it. What I mean by that, if you eat more calories than you burn, you're going to gain weight. If you eat less calories and you burn more calories than you've eaten that day, you're going to lose weight. That's a very simple fact. So let's put it in terms that may be a little better for you to understand. Okay, so a car burns gasoline and it burns oxygen. And that's how it motors along down the street. We burn calories and we burn oxygen. And that's how we motor. Our calories is our energy source. But if you don't burn all the calories that you've eaten, those extra calories, you know where they're stored? They're stored in those fat cells. And once they're stored in the fat cells, that means that we're gaining weight. So we must be cognizant of the fact that we can't eat more than our bodies will burn over a 24-hour period. Now, how do we know if we're fat or if we're overweight or if we're obese? There's something called the body mass index. And the body mass index, basically, it's a way that we can determine a certain number via our height and our weight. And we put it in a fancy equation, and it comes out with a particular number. Now, these numbers will tell us if we're normal weight, if we're overweight, if we're obese. Let's just go through some of the numbers just for real quickly here. If the body mass index is 18.5 to 24.9, you're normal. If you're in that range, you're normal. And how do we get our body mass index? You can go to Google and just say BMI or body mass index. It will allow you to put your height and your weight, and then you hit enter, and guess what? A number will pop up, and it'll be within these ranges that I'm talking about, and you'll know whether you're overweight or obese. 25 to 29.9, you're overweight, and that's when you know you need to lose some weight. If you're greater than 30, you're obese. If your number is greater than 40, you're morbidly obese. So these are the type of numbers that we look for to tell us where we are, how much weight we need to lose, and how critical it is that we try to really stay within that ideal body weight, how much weight we should be for a certain height. Okay, and for more information, remember guys, go to eat1half.com, all right? That's eat1half.com. Get more information about your weight. All right, let's get to the meat of the show. This show, we're going to talk about common medical diseases. And what we mean by that is there are certain diseases that are just, I mean, it seems every time we turn around, somebody has that problem. So let's talk about some of those tonight. I have the perfect person to go over some of these diseases, and we'll tell you what they are. Tonight, I have Dr. Dean Rice, and he's an internal medicine specialist at Newark Beth Israel Medical Center. Welcome to our show, Dr. Rice.
Pleasure
Welcome.
to be here. It's a pleasure.
All right.
Thanks for having me.
Glad to have you again. I'm telling you, it's always a pleasure, having you on the show because we always learn so much. All right. So what we're going to start with, one of the diseases that's very common. Goodness gracious, my mom had high blood pressure. You know what I mean? Most of my patients coming in the office have high blood pressure. But we're going to talk about it because it's just such an important topic. That's going to be our first topic we're going to talk about. Okay. Then we're going to try to grab onto a little diabetes, talk about that topic. And if we have time, we're going to go into a little heart disease, if we have time. Okay. If not, we'll bring you back and we'll start talking about heart disease and some other diseases as we go on to with this series. Okay, so high blood pressure. What is hypertension?
The definition for a patient when we talk about people having high blood pressure or hypertension is a blood pressure significantly over 140/90. Okay. The blood pressure is made up by two numbers, the systolic and the diastolic blood pressure. Mm-hmm. The systolic is the force at which the blood is pushed out from the heart, and the diastolic blood pressure is the resting blood pressure. Okay. So we have a two-number kind of a system that we use, and anything over 140/90, you're classified as strict hypertension. Oh, right. And so it's just a measure of the force of how blood travels through the blood circulatory system. Okay.
Should people have a blood pressure cuff at home and check their own blood pressure sometime just to make sure that I'm not kind of out of whack? Because, I remember in the olden days they used to say it was the silent killer.
Yeah, it still is. Yeah.
So
I think it's a very good idea in order to achieve and maintain wellness, you have to have some kind of a monitoring system. Right. And it's kind of difficult for people to come to the physician office. I mean, we recommend 1-2 times a year, depending upon your age. But if you can, the main way to monitor blood pressure is really through ambulatory blood pressure monitoring. And ambulatory blood pressure monitoring. I'm so sorry.
Ambulatory.
I do it. Okay, so to see what your blood pressure actually is in real life. Okay. As opposed to when you come see your doctor once, twice, 3 times a year. Mm-hmm. We get a snapshot. We'd like to have a moving picture and to see what your blood pressure is. So you bring up an excellent point. We need to know what it is at home, what it is when you get up in the morning, what it is when you're watching TV, when you're doing your family activities. All we know as physicians, myself included, is what happens when you come through my waiting room. We get your registration, we take your copay, we tell you all of these things and how this procedure is going to go. We tell you just going to have your blood test, and that naturally is called. There's this thing called white coat blood pressure, white coat hypertension. Yeah. When we intimidate people in that particular setting, and we note that people's blood pressure often is higher. Mm-hmm. But you bring up a good point. It's excellent to have a cuff, a blood pressure monitor at home, but you just need to know how to work it. Right. And you have to do it correctly. And I tell a lot of my patients is when they have one at home, and they'll come to the office and they'll say, my blood pressure was fine at home, but every time when I come here, it's high. And I'm saying that does not sound. It's not inconceivable. It certainly can happen. But I'd like to see you bring your cuff with you when you come. Let's have a conversation with myself, you, and your blood pressure cuff. We call that calibrating the blood pressure. And I think it's an excellent idea. There's a couple of kinds. There's the kind where you use a stethoscope like you have. Right. Then there's the electronic monitor that goes on the upper arm. Then you have one that goes on the wrist as well. Mm-hmm. The one on the wrist is easier, more convenient, but it's less accurate than the one on the upper arm because we're getting the brachial blood pressure, and this one is what we call the radial blood pressure, so it's a little less accurate. The one on the upper arm is okay as long as you have the sensor in the correct position. It'll tell you where to put the sensor that actually reads it. Yeah, you have to have that correct, and then certainly the gold standard is a stethoscope. And a cuff when you're listening to, when you hear the first hear of the heartbeat, and then when you hear when you don't hear it anymore, and that's the diastolic. Mm-hmm. So, but I think it's a very good idea, and I encourage my patients to have, especially if they have high blood pressure, to have a home blood pressure monitoring system.
Is there a time of day that I should take it that is more reflective of what my true blood pressure is? Do you think, like in the morning or when I get home from work and I start yelling at the kids, or when should I take it?
So that's what that brings up this whole thing about ambulatory blood pressure monitoring. You should do both.
Right.
You should do both, and you don't want to just take it when you're relaxing and feeling very non-stressed. You want to know what's happening, what's your real life or your real-time blood pressure is. So
right.
I would say you have to do varied times, and certainly if you feel it.
Oh.
So as you mentioned, you had a rough day for whatever it is, home with the kids, managing, or work, or any kind of stress, and you feel not so good, that's an excellent time to take it and take it correctly and document it.
Right, right. Now you've gone through all of my preliminary questions, like how do you take it, why do you take it, when do you take it, and where do you take it? Boy, oh boy. But the thing of it is that do you find that this blood pressure is more common in females or males, or is it any and everybody can have it?
They have statistics they go by. Maybe 20, 25, up to 30% of people walking around in the country have elevated blood pressure. Now we're talking about over 140 over 90, and it's most often we see higher levels in younger people in African American population.
Oh.
We see younger people with accelerated hypertension, younger people with high blood pressure in the African American population. It's higher in men. It's higher in, I don't know if we're going to go through, in people who are obese, if you smoke, if you have a high cholesterol, if you have a type 1 or a high stress kind of a personality or job.
Right.
So we've noticed that there are certain subsections of the population that have an increased risk, certainly with kidney disease, diabetes associated with increase in elevation of blood pressure, in people with elevation of blood pressure.
Right, right, right. Now, is there a certain age that we should start looking for it?
Yeah.
For instance, kids coming into the office, you really don't have to worry about it. Is that true, or should we be concerned about our kids as well as adults?
Oh yeah. Because, it's familial, so high blood pressure runs in families. Right. So if you have a family history, certainly you have a higher chance of having a predisposition, or you have a chance of having high blood pressure. We recommend that anyone, whenever you go to see a doctor,
right.
we call them vital signs. So,
right.
and there's a reason, because these are the things that actually make up your health. You want to take your temperature, your blood pressure, your pulse, and your weight. And you put your weight associated with your height, as you mentioned, with the body mass index, and we're getting more and more in tune with these kind of numbers. But after a certain age, depending upon after age 30, if you have a family history, you should be checking your blood pressure every once, twice a year. After age 40, even more. And then when you're in your 50s, you have to go 2-3 times, depending upon whether or not you have a history of high blood pressure. And we find that people with, well, I don't want to go too far, but people with high blood pressure who are treated, we're getting 60% of people who have high blood pressure who are adequately treated. And that's what the health initiative is going on. This Affordable Care Act is making us more responsible for individuals' health, and they're trying to get us to be more on top of that and try to get these numbers to represent the therapy that we're giving. So, as your blood pressure should be monitored, and it should be at least monitored every time you see a healthcare professional.
Okay. Diseases that come about because you have high blood pressure, and you have not taken care of it. For instance, I'm losing my vision. You go walk by a dialysis center and look in there and see who's lined up. Tell me about these things and what what we can do, or how does it relate to blood pressure? These secondary problems, secondary medical problems.
As you mentioned in early on in our talk, we talk about the silent killer. What happens is you don't notice it. It really affects the smaller blood vessels in the body. And you mentioned classically vision, kidney disease with the small blood vessels, peripheral arteries or vessels, veins, and arteries that supply the legs. The heart gets enlarged, and this what we call this end organ damage. And what happens is, once these things happen, you've had high blood pressure for a considerable amount of time.
You mean years? Yeah,
for years. Right. And we find people will come in their 50s and start having more and more